Now it's 6, summer shutdown. Coronavirus forces the mayor to cancel some of the most popular parades in the city. And a nursing home nightmare. As many as 70 people may have died from coronavirus at this facility. Tonight, the I-Team investigates what went wrong, the troubling decisions we uncovered. Plus, testing hope. New York ramps up antibody testing, how it works, and what it means for you. Good Monday evening. Thanks for joining us. I'm Natalie Pascarella.
And I'm Chuck Scarborough. We have some breaking news for you. In just the last 15 minutes, President Trump said the Governor Andrew Cuomo is visiting the president at the White House. Here's what he just said.
A lot of good things are happening in New York, and I think the governor is going to come in to see us tomorrow. He's coming to the Oval Office tomorrow afternoon. Andrew is going to be coming in with some of his people, so we look forward to that.
Meanwhile, Mayor de Blasio canceled all permanent events scheduled in June. That means there will be no Celebrate Israel parade, no Puerto Rican Day parade, and no Pride parade. And it appears we are on the other side of the curve in a crucial category now. The number of people admitted to hospitals across New York State has fallen dramatically from the peak. But the virus does continue to haunt city schools. The Department of Education says the number of teachers who've died from COVID-19 is now 25. A total of 63 Department of Education employees have died. Our team is standing by to walk you through what we know at this hour. News 4's Andrew Siff starts us off with the crushing cancellations the mayor announced today. Andrew?
Yeah, Chuck, this is a really big event. Where I'm standing on 6th Avenue, the heart of the route of the Pride Parade. They expect some 2 million people to attend that event. It was scheduled for June 28th, canceled today, although the mayor offered just a hint that events like this could be postponed till later in the year. Millions of people bursting with pride won't be allowed to celebrate in person.
To take that and have to put it on pause for folks was not an easy decision.
Heritage of Pride's David Correa reacting to the news the Pride Parade set for June 28th canceled. So is the Puerto Rican Day Parade, June 14th. Meanwhile, uncertainty continues as the pandemic marches on. Doorman Vinny Hernandez anxious about his subway commute to work.
I was taking the train for work. Today I actually bought a bike, so I didn't have to ride the train anymore.
Outside Borough Hall in Brooklyn.
Thank you.
Borough President Eric Adams handing out the face coverings that are now mandatory.
Giving them this mask, it is really alleviating some of the burdens.
City Councilman Bob Holden said essential workers should have a better option after 79 transit employees have died.
Underground, we don't have social distancing, and you can see that that's a recipe for disaster at this point.
But MTA Chairman Pat Foy told me frontline workers need a way to get to their jobs.
We are providing 75% of normal service for 5% of our passengers.
As for social distancing, after a weekend of uncomfortable crowds in some spots, the mayor again rejected a city council plan to open streets like Park Avenue to pedestrians. Meanwhile, we asked if events like Pride could be rescheduled. Realistically, can those events happen in calendar year 2020?
Andrew, they might. I mean, this one, it's a great question. I think, again, for all of us sports fans, we're asking this question. Can, our leagues come back in 2020 at all? I think this is an area where we don't know yet.
One of the next big decisions, the fireworks, July 4th. The mayor's office said a decision forthcoming in a number of weeks. As for the governor's visit to the White House, no context yet about what might be on the agenda. We're live in Greenwich Village. Andrew Siff, News 4 New York.
All right, Andrew, thank you. Experts insist that testing is still one of the most critical keys to reopening our economy, both diagnostic and especially the antibody testing. And today, New York is expanding both. So how does antibody testing work, and can you get one? That's the big question. News 4's Adam Cooperstein live at Mount Sinai Hospital to break this all down for us. Adam.
Yeah, Natalie, it can be confusing, but there's two basic types of tests. The diagnostic test to see if you have COVID-19, and then this antibody test to see if you already had it and maybe didn't know about it. And officials say that this type of test to see who may now be immune to the virus could help them eventually restart the economy. A surprise for shoppers on Long Island today, antibody testing inside a ShopRite in New Hyde Park. One of the unannounced locations organized by the state.
You just have to find a way to be on a street corner or whatever and actually get random people.
Governor Cuomo says the state's conducting 3,000 random antibody tests per day. The goal, to determine what percentage of the population has been infected with the virus and may now be immune.
It could lead to reduced anxiety and also to just an overall better approach to this virus, which is going to be around for a long time.
Dr. David Rich is the president of Mount Sinai Hospital, which received emergency use authorization for its antibody test. The primary use, finding donors with blood plasma that can be used to treat COVID-19 patients. But the antibody test can also help healthcare workers and others on the front lines.
We can't guarantee they won't be reinfected, and they will still have to wear their PPE.
Governor Cuomo has promised aggressive, large-scale antibody testing, but to do it, he says the federal government has to help New York get enough materials.
My 300 labs are now saying I can't get the tests from the national manufacturer.
Meanwhile, diagnostic testing for COVID-19 expands in the city with new walk-in sites in underserved communities hit hardest by the outbreak. Public advocate Jamani Williams says it's an encouraging step, but more needs to be done.
The other thing, of course, we're asking the federal government to continue sending resources and tests, but I think it's time for the federal government to send these tests directly to the city and skip through the state.
The city also announced they're expanding community testing to a NYCHA public housing center in Queens this week. One other thing to keep in mind, the World Health Organization warns that the antibody test does not prove immunity, even ones that are authorized, like the one being created here at Mount Sinai Hospital in East Harlem. Reporting live, Adam Cooperstein, News 4 New York.
All right, Adam, thank you very much. The human toll remains painful. New York reported 478 deaths from coronavirus in the past 24 hours, but that's the first time the daily toll has been below 500 since April 2nd. And here's where the numbers across the tri-state area stand tonight. Combined, nearly 350,000 people have been diagnosed with COVID-19, and more than 20,000 have died. In New Jersey, Governor Murphy says the pandemic appears to be stabilizing. Later this week, the governor is expected to share a blueprint for reopening the economy. But he cautions New Jersey needs to double its testing before businesses can start to reopen. Meanwhile, state health officials have released a list of 425 nursing homes where there have been coronavirus outbreaks.
And Chuck, officials in Connecticut reported 1,800 new coronavirus cases today. That brings the total there to nearly 20,000. Sadly, more than 1,300 lives have been lost. And just a few hours from now, everyone in Connecticut will be required to cover their faces when they leave their homes. A mandate goes into effect at 8 p.m. So if you're out in public and you cannot stay 6 feet from others, you have to wear that face covering.
In Natalie, an investigation is underway after 3 men died at a Manhattan hotel that was being used for quarantine. The men were staying at the Hilton Garden Inn on West 37th Street near 8th Avenue. And sources tell us that 2 of the men died on Saturday. The third died yesterday. The cause of those deaths is not clear. Mayor de Blasio says the 3 men had recently been released from 3 different hospitals after recovering from COVID-19.
We absolutely are going to check on people more deeply in that facility because we want to know, that hotel, we want to know exactly what's going on, and we're confused how this could have happened.
The mayor says the city will add extra personnel to check on all guests staying at the hotel used for quarantining. Natalie?
A nightmare, Chuck, is playing out inside this nursing home in Andover, New Jersey. As many as 70 people might have died from COVID-19 at the Andover Subacute and Rehabilitation Center. Well, tonight, the I-Team has exclusively obtained documents from the day the first 17 deaths were reported. News 4 investigative reporter Sarah Wallace reveals the questions these raise about how this facility is managed.
Dean Hawthorne sealed the back seat of his van with protective plastic outside Andover Rehab Center in Sussex County, New Jersey. He drove down from upstate New York to take his brother out of the facility, worried he might become a casualty.
What was the trigger that you said, I'm getting him out of there?
Just the 17 deaths and the fact that he is high risk.
The discovery of those bodies, found stacked in a makeshift morgue, sparked scrutiny into this sprawling center as the number of deaths skyrocketed. Hawthorne says he started getting worried last month when his brother said he'd been restricted to his room with another man who had COVID symptoms. A sign was put on the door.
Eventually, they did tests that were made, but my brother had been sitting in a room with them for over a week, I think, with him coughing.
And you don't know what the results are?
We don't know what the results are.
That's one of the concerns raised in a health department internal report the I-team reviewed from April 12th, the day after a request for body bags. The report says patients suspected positive but awaiting test results are not isolated from other patients.
Even if you got sick, they didn't plan on taking you to a hospital.
The report added a decontamination process for PPE extended use is not present at this facility, and staff are reportedly taking contaminated PPE home and returning to work with the same PPE for reuse. Congressman Josh Gottheimer told MSNBC proper protection and staffing are plaguing nursing homes around the state.
I've heard from 45 facilities in my district that say they have a moderate to an urgent need for more protective gear, for more personnel, because we have such shortages because of the outbreak.
But the report we reviewed suggests systemic issues with Andover. And today, the state health department issued new requirements.
We are requiring them to hire a consultant administrator, a consultant director of nursing, an infection control professional, and they are to cease all admissions.
We did reach out to the primary owner of the rehab center here, but didn't hear back. In the past, he has maintained that staffing levels are solid and that weekend and holiday issues contributed to all of those bodies piling up. From Sussex County, Sarah Wallace, News 4 New York.